Hello guys, my name is Muiz and this is for the chemical antisepsis part 2 for the surface acting agents. Uh, Mainly we start with the quaternary ammonium compounds which known as QACs. So quaternary ammonium compounds are cationic surfactants which is surface active agents that combine bactericidal and virucidal which is generally only envelop viruses and then the activity with good detergency and therefore cleaning abilities. So for examples which include cetrimide, chlorhexidine, and benzalkonium chloride. And we move for the second part, which is the alcohol concentration. For alcohol concentration, we mainly use 70% of alcohol, which upholds the key requirements for use as bactericidal in clean rooms or medical facilities, but also for general purposes. So for this alcohol concentration, the water solutions are produced less vapor and odor, therefore reducing risk of toxic fumes and combustion. And for the third one, which is a derivative of nitrofuran, for this part, we are using fluorosilane solution. Nitrofuran derivatives have antimicrobial activity and are used to treat infectious diseases. So for the pharmacologic effect, which includes it is an antibacterial substance that acts on various gram-positive and gram-negative bacteria. Examples such as Staphylococci, Streptococci, dysentery bacillus, and etc. And for the last one, which is the nitroimidazole derivatives, for example, we choose metronidazole, which is flagyl. So nitroimidazoles are widely used for infections caused by anaerobes, some vaginal infections, and Helicobacter pylori gastritis. So for this method, for this part, aerobic bacteria are intrinsically resistant to nitroimidazoles, and they are highly active against protozoa and are the first-line treatment options for candidiasis, amoebiasis, and trichomonas vaginitis. And at the same time, nitroimidazoles are generally well absorbed following oral administration. Thank you, that's for my part. Hello guys, my name is Muiz, and today I will talk about systemic chemotherapy, which is oral chemotherapy. Many types of chemotherapy are given intravenously, meaning through an IV or by injection into your bloodstream. But there are also types of chemotherapy that patients take in pill or liquid form by using mouth. There are a few things about how to take this medication safely. Firstly, you should go over all your medications, including all over-the-counter prescriptions, before you start your oral chemotherapy. Be sure to tell all your doctors that you have been prescribed oral chemotherapy. Once prescribed it is important that you follow the directions exactly when you take the oral chemotherapy medication. This means when taking the right dose and at the right time. So, we suggest you to use a diary to keep an accurate record of your doses and any side effects that you may have. And it is also important to refill your prescription as soon as possible. The caregivers must wear gloves at all times when handling them. Make sure to throw away the gloves after each use. Patients taking the medication don't need to wear gloves since the medicine is going into their bodies. Keep the medication in the original containers you got from the pharmacy. It could be dangerous to mix the oral chemotherapy with other medications because they could be affected. Please remember to wash your hands before and after handling the oral chemotherapy. Make sure to follow the storage instructions on the container exactly and always keep it away from children and pets. There are a few things to remember when taking oral chemotherapy. Firstly, pregnant women shouldn't handle this medication. Secondly, when you go to the toilet, flush the toilet twice after you're done.
and if possible, use a separate bathroom. And for the third one, make sure to practice safe sex by using safe condoms. By the fourth one, do not eat or drink grapefruit or any other product containing grapefruit in it because grapefruit can prevent your body fully absorbing the medication. And last, do not crush, cut, or chew your pills. You must swallow them whole. Possible side effects for taking oral chemotherapy may include hair loss, skin changes like rashes or sensitivity, mouth sores, bruising, feeling tired or fatigue, or also feel nausea or vomiting, and also gastrointestinal issues such as diarrhea and constipation. Do please call our emergency if you have a temperature of 38 degrees Celsius or more higher than that, or you may feel like a flu, symptoms like a fever with chills, cough, or like a sore throat. At the same time, if you feel like having shortness of breath, dyspnea, pain when urinating, or you may have blood in your urine or stool.
Thank you for watching and stay safe. Goodbye.